I'm Dr. Sherwood. I'm Associate Professor here at Northeast College of Health Sciences. I teach the Activator elective. The Activator is a technique that uses an instrument to assist in the adjustment. The Activator technique, according to the National Board of Chiropractic Examiners, has been used by up to 50% of chiropractors in their practices. The Activator technique is a system that was developed by Dr. Arlen Furr and Dr. Warren Lee back in 1967. The whole purpose of Activator is to provide a system of testing protocols so you can determine where the problem is, whether it's at L5 or L4 or L3, L2, and determine what the problem is. Is it a rotational problem? Is it a flexion extension restriction or malposition? Is it a lateral translation problem? The Activator can be used not just on the spine, but on the pelvis and also on the extremities, the TMJ. It is a very effective type of treatment. A lot of chiropractors will use an instrument adjusting technique when hands-on may not be in the patient's best interest. The Activator makes a very nice, precise contact. The force is minimal, and you can provide very good care for your patients. So the whole technique is kind of a nice package in terms of being able to run through an assessment protocol, figuring out whether a segment or an extremity or whatever is part of the overall patient complaint and underlying problem, and then using the Activator to correct. And when I say correct, actually moving the bone, but also stimulating mechanoreceptors in the area to help facilitate resetting of neural patterns. Would you please test for and correct T4 on the OPD side?
Okay. Nikki, can I have you turn your head to the left? And then I'll have you raise that left shoulder up off the table and you can relax.
So again, this is an isolation test for T4. And now what Sandro is going to do is check for a positive finding. Go ahead.
So positive finding would be shortening, relative shortening of that PD leg in position 1. Then we bring up to position 2, and since it's the OPD side this time, we would see relative shortening again.
Very good. And take your contact.
Is it okay if I palpate again? So I'm just going to palpate my way up. 6, 5, 4. And then over.
Over and up to the TP.
Over and up to the TP. And slightly medial added to that.
Anterior, superior, slightly medial. Good. And then?
And then we have to adjust the rib as well for the thoracics. So same segment, just come up and over, off the TP, onto the rib, and then there would be my vector.
And the line of drive is inferior and lateral. Good. Excellent. Thank you. Thank you very much.